Hello, my name is Alec Egan, and I am a current fourth-year medical student at Texas Tech University Health Sciences Center School of Medicine in Lubbock, Texas. I'm excited to present today our poster on rapidly deployable UVC light surface and PPE decontamination at an outpatient procedure center for the prevention of COVID-19 transmission. Back in March of 2020, myself and the rest of my medical school were sent home to quarantine as COVID-19 took off in the United States. Our medical school developed a task force seeking to develop new innovations to help in the fight against COVID-19. One major struggle early on in the course of the disease was the lack of personal protective equipment for healthcare workers across the country. There were many different proposals around cleaning and sterilizing personal protective equipment so they could be reused rather than disposed of. Many of these initial proposals were pretty complex and very expensive, and they were not able to be easily replicated at small, low-resource hospitals and clinics. Myself and my fellow medical students are from West Texas, where many of our rural hospitals and clinics have to provide the full scope of medical care while being hours from the nearest tertiary referral center. My group and I looked into using different methods for PPE sterilization, but decided to settle on the use of UVC light because of its rapid deployability and known efficacy as a sterilization method. We had a UVC light donated by one of our attending physicians and worked closely with the endoscopy suite here at the University Medical Center in Lubbock, Texas. Our first challenge was how to mount the light source. We worked through multiple different mounting techniques, but eventually we designed a simple method for mounting the light on a Mayo stand. We liked the use of the Mayo stand because rather than building or ordering a contraption to mount the light, a simple Mayo stand can be found at almost every hospital and clinic around the country. We also worked through different methods for testing the amount of radiation that could be applied from a single UVC light source. Through a lot of coordination with local labs and a grant, we were able to acquire disposable card dosimeters to measure the amount of time required to sterilize a fixed object underneath a UVC light. You can see what the mounting setup and card dosimeters look like in the pictures seen here on our poster. Finally, we utilized an inexpensive Bluetooth remote control to allow the light to be turned on and off from outside the room to reduce exposure by the staff who would be utilizing the device. Our method was completely successful. With as little as 15 minutes of exposure underneath the light, we could show that enough dose was applied to the surface to effectively kill the bacteria MRSA, the bacteria Clostridium difficile, and all viruses. The endoscopy suite is still utilizing our method to help reduce disease burden on PPE like N95 masks and other commonly used items. UVC lights like the one we utilized are relatively inexpensive and can be acquired fairly quickly. We believe this kind of rapidly deployable and relatively inexpensive method could be used to help sterilize personal protective equipment in the event it must be reused, especially in low-resource environments where more thorough or expensive methods are unobtainable. One of the limitations that we faced was acquiring accurate dosimeters, especially during a global pandemic. In the future, we hope to be able to more accurately measure the amount of UVC radiation that can be generated by these UVC lights and to build a more stable and sustainable method of sterilization by UVC light in clinics in our area. We would also like to better understand how UVC light affects different surfaces through more thorough testing. We really appreciate your time today and look forward to answering any questions you have. Thank you.